And we'll go ahead and dive right in. As we move through our presentation, we've tried to keep the didactic information sort of brief. Please do feel free to send us your questions in the chat. I'll try to track those as we're going, and then we'll have plenty of time for questions and answers at the end of the presentation this evening as well. You can send those to the whole chat or directly to me if you'd prefer to remain anonymous. As part of today's agenda, we're going to talk about a couple of different things. We're going to talk first and foremost about this really exciting pilot study that we recently completed at the Lurie Center, and we'll tell you a little bit about the study results and an overview of the study. As part of this, we'll talk with you about this specific and newly designed parent CPI class. We'll share some general tips and resources, and then spend a bit of time in questions and answers at the end of the evening. We do want to make sure that you all know that the study that we're going to be talking about tonight was funded by the Crisis Prevention Institute. So we want to give you this general conflict of interest statement. This was actually a project we approached them about, and we were really, solely responsible for the design and implementation of. They were excited to work with us on this project and did fund us, but it really was a project that was initiated and sort of born out of the Lurie Center and the need that we recognize. So while we do receive funding from them and very much appreciate their support, we are really excited to talk with you about this exciting research project. And I'll go ahead and pass it now to Nicole, who's going to dive in and get us started.
Great. Thank you, Lisa. First things first, we appreciate you pre-gaming with us before the big Celtics game tonight. For those of you who are fans, we will definitely get you out of here in time to enjoy that game. And before I start, just a question for the group. I'm curious if anybody watching tonight actually participated in the research study. And so you can just write in the chat if you did, only because I know that there were many folks who participated that were interested in learning the results of the study. So great, looks like we have at least one. And welcome to the rest of you. We're excited to share more information about it. So how did this project start? As part of my role at the Lurie Center, I am also the head of the safety team. And as you can imagine, we have several patients who come to us each week and may have challenging behaviors during their appointments. And so because we're an outpatient clinic, we typically ask, and I guess our hope is that families, parents, and caregivers will take the responsibility to manage those challenging behaviors when they're in our clinic, knowing that we have a CPI trained safety team that can help as needed. There was an incident, and this is now several years ago. We've been working on this project for quite a while, but there was an incident in our clinic at one point where a child was having difficulty. They were aggressive and having challenging tantrum-like behaviors. And the parent, who was just doing her best to manage those behaviors as a means to sort of de-escalate and control the situation, put her full body weight on the chest of that patient, essentially sat on him, which kind of, for those of us or those folks who are watching, was sort of this immediate safety concern about, what's he going to be able to breathe? And was this the best way to manage that situation? And just to be clear, no judgment, okay? Because we know, and that's sort of the point of the talk today, that training doesn't exist out there. So this parent was doing the best she could in that moment, but it was alarming in that there could have been some real risks there. And so we brought that incident, to our monthly safety team meeting to review, as we typically do. And we're sort of talking about what happened and how our staff intervened and what good follow-up recommendations would be. And I remember this like it was yesterday. One of our safety team members suggested that we recommend to this parent to, participate in some form of restraint training. And a number of the folks in the group said, that's a great idea. We'll call this parent, we'll let them know. Definitely you should do some, training and restraint. And another safety team member said, well, okay, that's a great recommendation, but restraint training for parents just doesn't exist. And so kind of thought about that. We're like, and I did my own research to see, can I find any parent restraint training? No. And so, in future meetings, we continue to talk about this. We had this sort of light dawning moment where we said, all right, well, if this doesn't exist and it's such a great need, then we at the Lurie Center are in a prime position to change that. So why no physical training for parents? Many companies, including CPI, the one that we're talking about today, that offer physical training for professionals, do not offer the training for parents. In the chat, anybody want to take a guess as to why? Or you can just unmute if you'd like to do that too. But any guesses as to why physical training does not exist for parents?
Liability? Is that right?
Bingo. You got it. Liability. Why? Because parents are not supervised and monitored in their homes, right? So when you think about these companies that are training professionals, they're training professionals in settings where certified trainers are watching, supervising, providing feedback, training and retraining. In a family home, that doesn't exist. And so these companies are worried that if something went wrong, so if somebody got injured, if somebody got hurt, whatever, a negative outcome occurred, that they would be held accountable. And so that was the number one reason I called a lot of these companies. And that was the number one reason that that was shared. Some of the existing literature out there, again, I think these numbers probably won't be surprising, or some of these this information won't be surprising to a number of you. Aggression, self-injury, and property destruction are the most impairing and severe behaviors in individuals with autism. And of course, these all come along with safety concerns. The prevalence of aggression in children and adolescents with autism is over 50%. So that's a very high number. And there's short and long-term consequences, right? So of course, the most immediate concern oftentimes is injury, right? Injury to the child, to potentially siblings in the household, parents, other community members. The emotional trauma that comes along with aggressive behavior, it can be scary for everybody involved, especially when it's consistently occurring. At times, because of the potential for severe safety concerns, the police may need to be involved. There may need to be a trip to the emergency department. And we know that aggressive behavior is the primary cause of residential placements. Severe behavior is also a primary predictor of parenting stress. Again, no surprise to any of you who are dealing with challenging behaviors in your home setting. And this also isn't surprising that just because there's no training for parents doesn't mean that they're not using physical interventions at home, right? You're going to do what you need to do to keep your child and everybody safe, even if you have no idea how to do it. And that's where, we see some of these situations where, a child or another family member could really get hurt. One thing that we also realized in doing our lit review for our study was that there was no existing literature on teaching physical management techniques to parents. Again, not surprising, but this led us to think, okay, I think research, a pilot study is the way to go in terms of next steps. So why did we choose CPI? Some of you may know CPI if you have a child in a school setting or an adult placement where they use CPI. You may have heard of the Crisis Prevention Institute. It's an internationally recognized organization. They offer nonviolent crisis intervention training, again, as I said, mostly to professionals. And for those of you who know it, it's oftentimes used in school settings, also commonly used in healthcare. You may not realize that it's also used in security settings, retail, right? And I found that a little bit interesting. Dementia care as well. We currently use it at the Lurie Center. So our staff, our safety team who assists when a patient has challenging behaviors, we are all trained in CPI, and we offer this CPI training actually to all of our staff. So we really encourage all staff to take CPI. I have been a CPI instructor, as I said, for 20 years. So it just made sense for us to reach out to this organization first. So what did we do? We sent a letter to the president of CPI, explained the concern, explained the need, and asked if they wanted to partner with us on this project. Again, honestly, I didn't think we were going to hear back. I thought, well, they know this is an issue, and if they wanted to do something about it, they would have already. To my shock, they wrote back, I think within 2 days. And to my shock and excitement, they wrote back immediately, and they said that they had been receiving weekly calls from parents, desperate parents, asking for this training. And so they were highly interested in this project. So that was just so, I just, again, remember that was so exciting to immediately hear back and think, okay, now let's think about this study. Lisa.
All right, so as we get into the study, we're going to talk with you a little bit about the research and some of the results, but we want to start by talking with you about how we thought through the goals of the study. So for those of you that are familiar with the research world, most studies will start with some hypotheses and a general aim. And in this particular study, we were really aiming to investigate the feasibility, acceptability, and safety of a Novel Crisis Prevention Institute, or CPI, one-day training. Along with that, we did have some hypotheses around the efficacy of this. And I divide these into two different sections here because as you'll see with our study design and with recruitment, and in particularly because this was really one of the first of its kind studies to look at or investigate a method for teaching these techniques to parents, there were some limitations in terms of our ability to measure efficacy of this intervention with such a novel study. So we really were primarily hoping to look at that feasibility, acceptability, and safety data. And we'll talk a little bit more about how we sort of moved through the research process. Next slide. All right, so who participated in this study? Again, the study, like all studies, have some limitations. We did have 80 parents total who participated in the study. And those parents were primarily female, primarily white, and many of whom primarily had completed high school or the equivalent. Their children ranged in age from 5 to 12 years old and had confirmed diagnosis of autism, as well as significant irritability. And we selected this particular population because we wanted to make sure that we were targeting a population of caregivers who needed to learn these de-escalation techniques. And so irritability is often associated with challenging behaviors. And so that was really one of the ways that we defined the population, really seeking out parents and caregivers of children who showed significant irritability. All of the parents who participated in the study were existing patients at the Lurie Center, and this was, again, really by design. We wanted to make sure that there was a comprehensive team and clinical care team supporting these families and supporting the children. Because this was the first time anybody has sort of ventured to formally teach parents and caregivers these sorts of de-escalation techniques, we wanted to make sure that they were taught within the context of a supportive clinical team. And then all of our participants were randomized or randomly assigned to either the intervention group, this parent CPI group, or a waitlist control group. And our waitlist control subjects were offered an opportunity to participate in the study at the end of the study. So once we completed, we wanted to make sure everyone did have an opportunity to receive the training. So our original goal was to recruit 60 total subjects, and we continued recruiting until 60 subjects had completed all of our baseline assessment measures, which is why that higher number of 80 parents total I mentioned in that first bullet. Next slide. Thanks, Nicole. So we'll talk a little bit about study recruitment and some of the challenges here. As you can imagine, it's hard to recruit parents and caregivers. You all are busy. You have a lot of things on your plate and a lot of things to do. So we had a total of 226 parents referred for the study who were referred to our research team and completed a pre-screening with us. It took us really a long time, a number of months to complete the training. So it took us 18 months total, longer than we had even expected to complete the primary data collection for this study. And the reason that this was such a challenge, the primary reason that folks told us that they weren't able to participate in the study or declined to participate is because of the extensive time commitment. And so we really recognize that the research burden was hard here, but we're excited to be moving this intervention into a clinical offering so that it can be more accessible to folks who are really busy in their everyday lives. And I think here we'll pass it back to Nicole.
Great. Thank you, Lisa. And I'm seeing some questions in the chat that we will absolutely talk about in terms of older children and adults and physical interventions, especially with smaller parents. So, but before we get there, an overview of the training, as we mentioned, Lurie Center collaborated with CPI personnel to develop the curriculum. So this is important. The core curriculum was based on CPI's nonviolent crisis intervention curriculum that is used with staff, but we really worked with them to modify it for parents and to really think about what might be helpful for a population of parents who have children with autism. The course that we offered was one full day in-person program. So we did 2 3-hour sessions. The first 3 hours, to sort of address one of those first questions that came in, was all non-verbal and verbal verbal intervention techniques. The second half of the class, the second 3 hours, were the physical intervention techniques. I was the facilitator, so CPI trained BCBA. We had small groups. And we used a multimodal approach. And that's something that I think works really well for CPI with professionals and certainly with parents. So we have visuals, we're talking, we're modeling, we're practicing. Like it's a course that you really, it doesn't matter how you learn, because we're probably going to address that with one of the modes that we use. We then had a 2-hour follow-up session that we conducted 3 months later. This was really just to do a follow-up to see if parents had questions based on the training, and also to find out, to get feedback on what we could have potentially done differently. So what were the results? I think most importantly, PCPI, parent CPI, is safe and acceptable to parents, right? So when we think about what we talked about originally in terms of the reason why companies aren't willing to train parents, it was really around the safety concern. And we didn't find that there were any significant adverse safety concerns, which was not only good for us to see, but good for CPI to hear. The parents found the program to be quite acceptable and enjoyable. PCPI, parent CPI, did not demonstrate short-term statistical improvement in parental self-efficacy. So these were some of the outcomes that we had talked about. We didn't necessarily have the best measures for this. We were sort of excited to see an exploratory analysis that there was an association with longer-term increases in parental confidence. Again, this is something that would require further studies or future studies, but this was an area that we imagined partially could have been due to the measures that we were using, that we weren't quite capturing what we wanted. But most importantly, safe and acceptable, I think, was enough for CPI to say, okay, we want to see this continued. Okay, so here I just have a couple of the graphs here. This is a graph on the kind of parental knowledge increasing from the start of the class until after the class. So you see that parents learned, right, which is important. That's something that was an outcome that we wanted to see. And that in terms, again, in terms of satisfaction, all participants rated the course very good or excellent, and really all aspects of the course assessed were rated favorably. So this was another real positive that we saw in terms of the feedback. Frankly, the parents loved the class. And I think in part it was because of what they learned. I'm not going to read all the comments. You can read them for yourselves. But I think the other reason why parents love the class is because they got to spend an entire day with like-minded parents maybe who obviously haven't had the same exact experience, but who could really identify with the challenges of having a child who exhibits, safety concerns and behaviors that need intervention. And so just the, I think, camaraderie and the support and the stories and the shared resources, I think that was as helpful as what was being taught. So it was just an environment that the groups of parents didn't often find themselves in. And so there was a lot of bonding that occurred throughout these courses, and in some cases, long, lasting connections. Where are we now? So at this point, because of the success of the pilot study, we are in the process of developing the manuscript or hoping to get it published. That's something that our research team is working on. That's separate from CPI. On the clinical end of things, CPI, again, was very excited with the outcome of this study. and they have begun training certified instructors. So the model that they have created is that if you're already a certified instructor, somebody like me, then you can take a course to be essentially have this add-on certification as a parent trainer. They are piloting the training both in the United States and in Canada at some well-known institutions. And so they're really excited about kind of getting the ball rolling. It really still in the infancy stages in terms of what they are offering. Because we did the study and essentially developed the course, we don't need to wait for them to fully roll things out before offering the course. So at the Lurie Center, we are now offering this parent CPI course, the one that we offered in the research project. We have had one done so far. It was full, and again, the feedback was quite impressive. Folks really enjoyed the course. We will continue to offer it, and and our hope is that we'll have a lot more parents who will want to take it. I think, where do we go from here, and where do we go? Where does CPI go? Where do we all go together? Strategic planning is needed to think about how do we increase awareness about this training, and how do we make it accessible to parents, right? And so when we think about accessibility, one question is around affordability, right? We want to make sure that all parents can afford the class. We want to make sure that the class is flexible. So again, going back to what Lisa was mentioning in terms of that difficulty with recruitment, this difficulty of taking one full day out of any of your days to devote to this training. We really talked with CPI about, can we think about having some sort of a hybrid option where portions of the training are remote, portions are in person? Should we do it over the course of several days instead of one? These are all, this was all feedback that we incorporated into the class offering that we are now providing. And then ideally, and this is just one of the things that we thought at the Lurie Center, we're offering this as a training, and we're certainly one of the first to do it. But ideally, we would see that this training is offered by the current providers that are working with your child, be that in early intervention, schools, in-home providers, that you're getting it from the folks who are also maybe developing the behavior plan and working with your child directly. So you have that nice relationship there. But at this point in time, as I said, CPI is slowly rolling out the program, and the Lurie Center is offering this course to not only Lurie Center patients, but really to anyone. Okay, so if you're here not as a Lurie Center patient, this course is available to you. So what can you do? What can you do to help? One is you can take the course, and we'll give information on that in terms of how to sign up for it. And also you could spread the word. So once again, you're hearing about this today. This is something that, and I've been in this field for a long time, I have a lot of colleagues, nobody knows about this, right? Because it's not out there. CPI is not quite promoting it yet. The only folks who know about it are those who are keyed into the Lurie Center and getting these updates. We want to let folks know that this is something that is going to be formally available to any CPI instructor to get trained in. And then we also share, as something that you could do, potentially asking your agency to offer this training, be it through their certified CPI instructors, if that's something they offer, or potentially partnering with the Lurie Center to see if it's something that we could provide to families within your agency or organization. And so, I think if you have an interest in this, you're learning more today, we're going to take questions at the end, but taking the course and then also spreading the word, because we want as many people as possible, as many parents, to have the opportunity for this experience. So a few tips, sort of kind of taking a step back from CPI. One of the questions that I would get about the class, or just something that I felt like I needed to share, is that CPI training alone is not going to solve all of the problems of the challenging behaviors in your household, right? We look at this as one piece of many different access points or supports that would be needed if you are experiencing challenging behaviors in your home setting. And where do we start? in terms of these behaviors, safety absolutely is the #1 priority, not just for the child who may be having difficulty, but also for the entire family, as I had mentioned earlier. If you have a child who is experiencing challenging behaviors, that should be the first question you ask. Is this situation manageable with the supports that we have in place? Or do we need to add in additional supports? And depending on how unsafe the behaviors are or how interfering they are, that might, dictate what that level of support looks like. Applying for in-home ABA services may be a good approach. I will say this, and many of you already know this, the wait lists are long for these services right now. So we recommend that you get on as many wait lists as possible. Even if you are able to get into an agency to get those services, there are staffing shortages. Again, this is probably no surprise to most folks in this group. And so your child may be eligible for, let's say, 10 hours a week, but they might only have staffing for a couple hours a week. And so that is something also that is, what you're going to want to be thinking about. The school program or the day program that your child is in or your adult child is in, they likely will have recommendations and strategies to carry over into the home setting. So we want you to be thinking about that too. We don't want to reinvent the wheel. If your child is doing well in whatever day program they're in or whatever other services they are getting, then we want that to be something that tips can be shared. Maybe there are visual aids, maybe there are reinforcement programs. Those are things that can be carried over as well. A home emergency plan, that's another area that is recommended to be developed or created should you have a child who has difficulty or unsafe behaviors in the home setting. This is something that can incorporate neighbors, other family members, local people. So you might, again, if you have other children in your home, you may be asking for support. If I need something for this child, can you come over and watch my other children? You also may develop a plan that involves going to the police department ahead of time and letting the police department know that your child may need assistance, that you might be calling them because of specific behaviors, that your child has autism, for example. You may make sure you have a list of the phone numbers of the crisis emergency centers, the crisis centers in your area, the ones that are local to you. Having that home emergency plan is another very important piece of what you would need to do when you're thinking about, what will be helpful if you have a child who has challenging behaviors in the home setting. Taking data. This is something that we just recommend, and just to be clear, when we recommend taking data to parents, we're not recommending that you are doing some complicated, involved, highly intensive data sheet system. We're talking about major incidents or particular behaviors, maybe that are unsafe. Having a format that is really user-friendly for you, and then thinking about how to share that data. Okay. So when you've taken that data on the number of times that you've had to ask your youngest child to, be locked in her room, right, because of the unsafe situation that's happened, the number of times there's been an injury to somebody in your family, the number of times that you've had to call the police, the number of times that you've been hit or punched, for example. This information can then be shared with a whole host of people. It can be shared with the school team. For example, sometimes school programs are more focused on what happens in the school day, and they don't really think about what happens at home, especially when they're not seeing the behaviors that happen at home, right? So if you have a child who's aggressive at home, but is an angel at school, never has any difficulty, that is something that the school needs to know about, because they potentially can offer supports. The school district can potentially offer supports, and that goes for medical providers. The pediatrician or the primary care physician should know these are the things that are happening at home. They may have recommendations on making changes, and then we can sort of look at that data to determine, do we need to make further changes? The funding agencies, the folks who are funding services also need to know. All of these different pieces, taking that data, sharing that data, is going to help you and potentially other members of your team advocate for what you need in your home to keep it safe. So this presentation was sort of focused on CPI and the research and the class, but again, I just want to stress that that is one piece of a much larger puzzle and picture of what you all would need at home in terms of thinking about managing challenging behaviors. So I think it can be very helpful, but again, I think it's one piece, and there's other pieces that you want to be thinking about as well. A little bit more about the actual class that we're offering. So we are offering, as I said, the parent CPI class. Because there was so much difficulty getting parents to come for one full day, we have split this class into 4 sessions. I think this question came up in the chat. The first 2 classes are virtual. So the classes that focus on the nonverbal and verbal de-escalation techniques are virtual, and the classes that are physical are in person, because it would be very challenging to teach physical interventions virtually. So we have 2 classes, an hour and a half each, that are virtual, 2 classes in person, and we do it over the course of 4 weeks. So that spreads it out. I think it makes the information more digestible, and allows parents to take some time and then come back with questions the next class. Currently, we're offering the class in October and March, and we will offer and add more classes as the demand increases, which we anticipate it will. To answer this question that has come up a couple times in the chat, is this training just for parents of 5-year-olds, 10-year-olds? No, we open this training to parents of children of all ages. However, okay, and this is important, and I think you can, make this assumption on your own. I don't have any magic techniques that is going to teach a smaller one person to physically manage a much larger, stronger adult child, okay, or adult. And so the physical interventions for older or stronger children, and by the way, I don't even really put an age on that, because there are 7, 6, 7, 8-year-olds who might be stronger than a parent. So the physical interventions for older and stronger children will require 2 people. We just put that out there because I think it's important to know and to not go into the class as a parent of an older or stronger child thinking that there's going to be a magic technique where you'll be able to manage on your own. I will also say, though, we've focused a little bit on the physical piece of this, just because that was what was novel in terms of what was being offered. CPI actually is not considered restraint training. CPI is meant to be a full-blown, de-escalation training. So it's all about prevention. It's all about what do we do before we get to the point where we're at a crisis situation where there potentially are physical behaviors. What do we do with our own actions? What do we do with our own responses? How do we intervene in such a way that, again, we don't get up to that high level? And so that really is the majority of the course. And I think that's so, so valuable. If you're coming to the course to take it of, just because I want to learn how to hold or, restrain, you're missing the point a little bit of what the course truly offers. So to answer the question from earlier on in regards to, do we talk about the nonverbal and the verbal interventions? We absolutely do. We spent a lot of time on that, and that is an area of focus of the class. Lisa, did you want to?
Sure, happy to jump in here. We've got some great questions coming in. So for those of you that are popping questions in the chat right now, I'm keeping track of those, and we're going to get to those in just a minute. I think we have just a handful of slides left. We wanted to also make sure that you're aware of other Lurie Center offerings, and these are available to people who are followed at the Lurie Center. So if you have a doctor that you see at the Lurie Center, and also to others in the community who are not currently connected with the Lurie Center. Nicole does a fabulous job offering a general behavior basics course. This is a 3-session virtual course series designed to help parents and caregivers develop a behavior plan in the home setting. Often these conversations are relatively small groups and very personalized. They're really a great place to start if you haven't had a chance to get to know Nicole in individual sessions, or you're looking to sort of refresh or strengthen your behavior management strategies. We definitely encourage you to think about signing up for our Behavior Basics series. And then we also have a course that focuses primarily on safety in the home and community. And this is a 1-hour virtual class, again, open to anyone, discussing common safety concerns, things that, safety in the car, in the community, in transitions, and really getting into the nitty-gritty of ways to address or support those safety concerns. So, as Nicole was saying, all of these things fit together as part of a larger plan, and our parent CPI class is one of those offerings, but we have a number of other offerings that I think really work well along with this parent CPI class. And so I would definitely encourage you to take a look at our website for some of those workshop listings, including Behavior Basics and our safety course. And you can call or email the Lurie Center to register for any of those courses if you're interested in those. Next slide. We want to include a few resources here, and I believe Anne can tell us in the chat if and how the slides in the presentation are sent out. I know we're recording this, and so we'll hopefully have it posted for you to review at a later date, but we wanted to make sure to include some additional resources. In addition to our workshops that I just mentioned, specifically focused on behavioral management strategies, we offer monthly coffee convos. You're participating in one of these now, so we assume that you have that schedule or have learned about that series already. Nicole Simon, who's on with us, who you've heard from lots tonight, is our senior behavior consultant at the Lurie Center. For those of you who have a doctor or cared for at the Lurie Center, we have a family support team. You've probably already interacted with one of our social workers to help you answer questions and connect with resources. We have an educational advocate, we run a number of parent support groups. We also want to highlight for folks who are not connected with the Lurie Center, there are a number of really wonderful community organizations, including your local autism support centers and some Massachusetts specific based advocacy organizations that we've listed here as well. Next slide.
Sorry.
No, that's okay. Nicole's following the chat here.
Yes, I was.
Got good questions coming in. We wanted to include a little bit of information about finding an ABA provider. As Nicole said, this can be a challenge. There are staffing shortages and oftentimes wait lists, but we wanted to clue you into a few different resources that we know and use often. So certainly contacting your insurance company to ask for a list of in-network providers is one really important place to start when you're looking to bill that service through your medical insurance. Reaching out to your local autism support centers. One of the things I really want to particularly highlight is this Mass Behavioral Health Access website. This website here actually allows you to put in some specific parameters and search for ABA agencies and organizations that are currently available or currently have staffing availability. So it's supposed to be kept up to date. We've had pretty good success with the website, helping us really narrow down companies and places to call when you're looking at kind of an overwhelming list. So check out that MBHA Access website if you're looking for some ABA agencies that might be able to service your child at home. And then we want to make sure, if you're not familiar with the Autism Insurance Resource Center, we really want to make sure that you have contact with this organization run by Amy Weinstock and her colleagues. She does a tremendous job helping families sort out difficulties that they're having accessing services, whether it's a difficulty getting the service authorized with your insurance company or finding an agency. Please make sure that you're in contact with Amy and her team at any point